Good morning, I'm John Hill. I'm the President and CEO of Bozeman Health. It's great to be with you and welcome to our virtual grand opening of the new critical care tower. This critical care tower started as a dream 2 years ago by members of our care team, the physicians, our nurses, pharmacists, and many of the therapists that contribute to the care of the sickest in our community on a daily basis. And this dream could not have been realized alone without the support of our great community. This community has done just a tremendous job in demonstrating support and compassion in helping us bring some of the greatest care to Southwest Montana. 2 years ago, we stood out in front of this building and proceeded with a groundbreaking event to celebrate the building of this new patient care tower. And this event also launched the Caring Forward campaign, a $15 million charitable campaign to bring in the community support to help build this new addition to the Deaconess Hospital campus. I'm pleased to report that through that campaign, we have raised over $18 million, far exceeding our goal to bring this new aspect of the Deaconess Hospital campus to our community, to our region, and throughout the state of Montana. I wanted to say thank you to our care team members, again, those physicians, nurses, therapists, and pharmacists who were so dedicated in developing and preparing for the opening of our new care tower today. They've been tremendous in their effort and their preparation and dedication. We also want to say thank you to all of those community leaders, to many individual donors who shared of their resources and generosity with us to be able to really bring this new care tower to life for our community. I wish to recognize Mike Noley of Noley White Group, Cushing Terrell Architects, and Layton Construction for the contributions each of them have made in bringing this new project to life. And specifically, I'd like to thank them for their dedication and safety in building this new building during a pandemic. Who would have thought 2 years ago that we would be in this situation we are today? It is with great delight that I also share with you that throughout this entire process, we have seen nothing but just great community support and anticipation for the services that will be brought closer to home here in Bozeman, Montana. I wanted to say thank you again to our board of directors for their dedication in committing and supporting this expansion of services, and to all of those members of the leadership team who have worked tirelessly to bring this effort to life. It is with great admiration that we again call out the fact that our care teams who have been working for the last 30 years in our old critical care tower to help develop and envision this new care setting. And they have just been tremendous in their efforts to be able to bring this service to life. And so we are grateful for their expertise and for their commitment. As we celebrate this brand new opening, I wanted to make sure that everyone knew of our just general excitement and enthusiasm to not only live in this community, but to serve those that need us the most in this new facility. It is with great admiration and honor that we're able to provide this level of service to not only this community throughout the Gallatin Valley, but also throughout the region. Today, as we walk through this new virtual grand opening, we do have a sense of honor and pride again for all of the opportunities that we have to serve those that stand most in need. And now it's my pleasure to turn the time over to Dr. Catherine Burtney, who is the president of Bozeman Health Deaconess Hospital and Big Sky Medical Center, and who has been instrumental in helping start this and open this new critical care unit at Bozeman Deaconess Hospital.
Thank you, John. It is my distinct pleasure to be here this morning to share this beautiful new space with our community and to introduce the innovative and technology-driven critical care unit that's opening this week in Bozeman Health Deaconess Hospital's new Bridger Tower. It would not be possible for us to be here today without the support of all of our project partners. So I'd like to warmly thank Noli White Group, John Summer, Bozeman Health Senior Project Superintendent, Holly Raycraft, our System Director of Healthcare Facility Transitions, as well as Cushing Terrell, Layton Construction, more than 15 subcontractors from Montana and Bozeman area, as well as City of Bozeman planning, building, and fire departments. Their work has made this dream become a reality from concept to today. Finalizing this work during a pandemic has been no small task for our team. The caregivers of the critical care unit have worked together to assure that we are bringing forward modern healthcare in the safest way possible in the midst of this pandemic. There have been hundreds of hours spent in simulation and training from our team. We had Vicki Grenowig, our Chief Nursing Officer, Val Reddick, the Critical Unit Manager, Kim Holst, the CCU Supervisor, Emily Miller, our CCU Educator, Dr. Andrew Sullivan, Medical Director for the Critical Care Unit, as well as the entire ICU, Intensive Care Unit, and PCU, Progressive Care Unit, working together for months as teams working on our transition, culture, staffing, standards, logistics, moving, and education. All this put together, we will be ready to open our 20-bed critical care unit this week and receive patients as they need care from us, from our community, taking care of patients and their family effectively in a way that will assure the best care moving forward in our future. And now I'd like to introduce Dr. Mark Williams to tell you a little bit more about that clinical care.
Well, good morning, everyone. We're excited to be here with you today to celebrate the opening of this beautiful space in our new critical care unit. The importance of access to high-quality care for Southwest Montana, the City of Bozeman, and local employers cannot be overstated. And we're proud to be a part of a health system that is so dedicated to improving community health and quality of life. Research shows, especially in rural areas, that the presence of a strong local health system that is dedicated to high quality, safe, and expert care for our patients positively impacts not only the health outcomes of the region, but also contributes to the economic health of our communities. We know that in communities like Bozeman, Belgrade, Big Sky, and surrounding areas, that having access to timely health care services allows individuals to pursue education, continue their work, enjoy a healthy life out of doors, and to contribute to the economic vitality of our region. And in the midst of this pandemic, when access to health care can be critically important, with crucial timing of the additional and upgraded ICU capacity, which comes online shortly, it provides Bozeman Health and our care teams the space, resources, and appropriate settings to expertly care for our sickest patients. We're especially grateful to have specially designed rooms within the new critical care unit that will help us to provide even better care for patients with infectious diseases, as our number one priority remains to keep our staff, patients, and community safe. With that, I'd like to introduce Bozeman Health's Chief Nursing Officer, Vicki Grenowig.
Thank you, Dr. Williams. And I want to thank each one of you who have joined us today in this celebration. I can't tell you how privileged and honored and excited all of us are to come to the completion of this project. As amazing as the architecture and the design and the furnishings are of our new critical care unit, the caring and compassion of our physicians and our nursing staff and our professional and support staff are really what will make our critical care unit come to life. You could say that it's committed people helping people. At Bozeman Health, our vision is that we would be your partners in health and wellness, and that we would compassionately deliver the best care to every patient at every time. During the construction process, from the early design phases to where we stand today, our care team has looked at all of their patient flows, their patient care flows, have looked at the rooms in which we deliver care and the spaces that we need, and they have looked at this through the perspective of the patient. You could say that we have looked at it through the patient's eyes. And if we could keep that in our focus, then we will have built a unit that has been built with the patients in mind and their families in mind, and that will help us meet that vision that we all believe in, to deliver compassionate care, the best care we can to every patient every time. Our care team will strive today and tomorrow and every week and every month and every year into the future to deliver the same compassionate, committed care that they want for their families, to your families, and to you. I want to tell you that that is our commitment that we will make on this beautiful day of opening the new care unit. Taking the care and compassion and commitment of all of our patients and all of our staff is something that I would like to thank them for. Thank them for today and thank them in the future for making a difference in the lives of the patients and the families that we serve. But I also want to thank each one of you who trust us with your care and your family's care, the care of your loved ones. We want to live up to our commitment to you in the beautiful space that we have been given. All of our Bozeman Health sites are open and safe and ready to meet the healthcare needs of our community. And our new critical care unit is open and ready to enhance and increase the care that we give to the community that we so dearly love. I want to thank you for allowing us to care for you and your families. And now I would like to introduce Katie Daughenbaugh, who is the board chairman of the Bozeman Health Governing Board.
Good morning. I welcome you to our refreshed sanctuary space in Healing Garden. Bozeman Health's faith, heritage, and value of spiritual connection in healing and care remains very strong. Deaconess Hospital was founded in 1911 in partnership with our Bozeman community and the Methodist Church. The Methodist deaconesses managed the hospital and cared for patients until the 1940s. We are very proud of this history and our continued connection to the United Methodist Church. With the significant investment in updating our critical care rooms and broadening our services, the Board of Directors believes very strongly that it is also important to continue to provide our patients, family and community members of all faiths a place of comfort, solace, and faith connection as part of their care experience. With the growth of our community, the interest and need for spiritual sanctuary has also grown. The sanctuary space has been expanded, allowing for as many 30 people to gather for spiritual care. The Healing Garden provides a quiet outdoor contemplative space for rejuvenation. For those who find healing in nature, this garden gives those that opportunity. We will be celebrating and consecrating this sanctuary space on Wednesday, September 30th at noon during a live virtual service. We hope you will join us. And now I invite us all to join Dr. Andrew Sullivan as he leads us through the new critical care unit.
We started with a week-long workshop where many of the different services in the hospital that serve the ICU came together and put together a plan of what was important to us, and that's gone into the design of the structure. It's going to be just a pleasure taking care of patients in it. I mean, number one, it's large. You know, we all of a sudden we won't be tripping over each other. Number two, it was really well designed to take advantage of the natural beauty of Bozeman. If you go to the family lounge area, to the family meeting room, areas that we hope post-COVID or in a world where we don't have to isolate so much because of COVID, that it's going to be a much more comfortable place for family members to hang out when their loved ones are in the ICU. There's workstations set up right outside the rooms where you can actually view the patients through the windows, so you can do, you know, we spend a lot of time doing computer/paperwork. Now we can do it as we're actually, you know, closer to the patient's bedside. We've gone from having 8 ICU beds to a possibility at any moment of having 20, which is a huge increase. And so that means whether it's the near future with COVID, whether it's the farther future as we recruit further services or continue to have community growth, we're well stocked for ICU beds. This is an isolation room for somebody who we're trying to isolate from a respiratory standpoint. So whether we're concerned about COVID-19 or tuberculosis, a patient in here has less of a chance of infecting a staff member. Despite the fact that we're dealing with coronavirus, I've just been impressed by the nurses, the respiratory therapists, the phlebotomists, the radiology techs. I think of them as just being fearless. Their ability just to put on the gear, do their job, not think twice about it, has been so impressive. We have been working for a year and a half in a very odd situation, like we're trapped in a cocoon, and then the gates of the new ICU open, and all of a sudden you feel like you can breathe fresh air almost. It just feels like it's a place that's made to do the work that we need to work in.
I became involved with Bozeman Health and the Foundation back in 2013 after my husband had been diagnosed with cancer. I saw firsthand through the Cancer Center the amazing work the doctors and the nurses are doing here, and it became very important to me to be a cheerleader for them. They are truly amazing at what they do. I would have never expected that I would end up here as a patient myself. In June of 2019, I had a freak bicycle accident. I thought I perhaps had a bruised rib, had the fortune of common sense of calling 911, and was brought to Bozeman Health and had emergency surgery to remove my spleen. The care here at Bozeman Health when I was in the ICU was truly amazing. These doctors and nurses are just so caring, so wonderful. I never for a moment felt that I wasn't given the very best medical attention possible. Making the new ICU come to life as a reality was overwhelming. The community support for Bozeman Health was really just an eye-opener to me about how much this community cares about the health care we have. We truly have amazing doctors, nurses, an entire team here protecting and taking care of our community. And the generosity shown by all of the donors within our community and outside of our community has really been heartwarming. To stand here in a new ICU room makes me smile. I think that we have really great nurses and doctors. They are the best in their profession, and now we have the ability for them to work in a really great environment. These rooms are really going to bring more comfort to our patients that spend time here. Having the ability to be with my husband while he was receiving care was extremely important to both of us. And with the new ICU and the rooms being larger, family members can be here. And it's so important for the healing of the patient, as well as the healing of the family member or the caregiver who is going through it as well. We have the best of the best here. The care is incredible, and I'm so very thankful to the doctors and the nurses who helped me survive.
I have worked in the old ICU since it opened in June of 1986. Having worked in the old ICU for 34 years brings mixed emotion for me. There's memories of happy times, all the staff that I've hired and had, all the patients we've cared for, the doctors that have been there. They're all good memories, but the constraints with our old unit has made it very difficult to take care of these patients. We're leaving that in the past, and we're moving to this great space that is going to provide the community, our patients, the physicians, everything they need to take care of our critically ill patients. The new critical care unit will be able to provide options that we never had within our old unit. The space is 3 times larger. We'll be able to get around the patient, which will promote safety, and to be able to work around them in an uncluttered environment. Currently, we have two separate units. We have the intensive care unit and the progressive care unit. The progressive care unit is a level of care provided to the patients that is not as intense as in the intensive care unit, but more than the medical floor or the surgical floor units. Our rooms in the new critical care unit are universal, so we can have progressive care unit patients or the extreme critically ill intensive care unit patients. If a less sick patient becomes critically ill, they don't have to move. The patient can stay in their room and work and focus on getting better. I can't even express how excited I am and how happy I am for everyone that is going to experience this. We will continue to take care of our patients as we have in the past. We will continue to take care of them in the future to provide the best care that they all deserve.
You've heard so many great things from our executive leaders, board leaders, our clinical experts around the attributes and characteristics of this new critical care tower. And we're just excited that it will continue to demonstrate and advance the mission of Bozeman Health, which is to improve community care and the quality of life. And now I'd like to turn it over to our medical director of the intensive care unit, Dr. Andrew Sullivan, to perform our ribbon cutting. Dr. Sullivan.